Welcome to the Excelsior Health Podcast. This is the podcast for busy professionals and busy parents that are battling weight gain, high stress, and a drop of self-confidence. What we do here, guys, is we take the complicated, confusing aspects of transforming your health and incorporating fitness, and we break it down to simple things that you can execute on so that way you can transform your health and you can rebuild your lifestyle. I'm your host, Coach Cory Fernandez, and guys, would you want the advice and the guidance of someone who professional athletes, when they're looking to prevent injury, when they're looking to recover from injury, come visit this guy. He's the owner of one of the most popular physios in all of Mississauga. And he's someone who's started a company from scratch and has built it up to be one of the most popular health companies in Mississauga and the GTA. So without further ado, my man, Brendan Gomes.
What's up? What's up? Happy to be here.
So as I was saying, man, like I've known you from when you were just kind of getting things started.
Just one room, man.
One room in somebody else's business. And how me and Brendan got to know, we have a mutual friend, Shay Pierre, who basically you guys probably would have listened to his episode already. But Brendan was hustling, man. Like you were just trying to get in touch with different gym owners and different people and help more people.
Yeah.
He started treating myself, and then we started to build this great relationship where a lot of our clients, we would refer to him. Because, hey, sometimes people are coming in with back pains and ankle pains and poor mobility. And then over the years, he's been able to send that same sort of love back, where a lot of people that are looking for the next step after they've recovered from some sort of injury is he'll send them over here to Training for Warriors. So I'm just super proud of this guy for all of the accomplishment he's done. He's recently just upgraded and expanded his facility to a top-of-the-art facility. So what I would say is, like, Brendan, let us know a little bit about you. You know, what do you do? And then, hey, tell us about, man, like the lab and everything you guys got going on there.
Okay. So my name is Dr. Brendan Gomes. I'm a chiropractor, and I'm also the co-owner of the Lab Movement and Sports Med. We're a sports-focused sports med clinic located in Mississauga. I'm happy to say we got a team of over 25 therapists. We have physios, chiros, osteos, massage therapists. We even have a sports medical doctor on the team now that we've just added. As Cory was mentioning, we just expanded the clinic. So we're at a 5,000 square foot clinic. We've added a team training section that just exclusively works with sports teams in the area. So we do the dry land, we do the therapy. We have it all in-house. We're a clinic that just works with active individuals, people that really care about getting themselves back. And we care about getting you guys back to being active or whatever sport or activity you guys love to do. That's where we come in.
And for the most part, you do work with a lot of athletes, you know, from professional athletes to university to weekend warriors, I'm sure. But I would say a large population of the people you help, they're busy professionals. You know, they're busy adults that they want to feel better. They want to relieve some pain. They probably want to be stronger as well. So what would you say is the biggest pain points that people come in, and why do you think they're dealing with those pains?
Yeah, I mean, yes, we have a blessing where we're able to see professional athletes of several levels, but a large population of our clinic is just active individuals that go to the gym. If you go to the gym at some point or the other, something's going to break down, and it's, I don't want to say you can't avoid it, but things happen in the gym, right? You cue a deadlift wrong, or you squat too deep, or whatever the case may be. Maybe you're overtraining, whatever the case is, that's where we come in. So with busy professionals in particular, especially those that work from home or work from a desk, one of the biggest things that we see is shoulder pain, neck pain, and low back pain. And the big reason for this is just because there is a lack of movement, and not just a lack of movement in terms of, frequency, how many times you go to the gym, how many times you're walking, but more importantly, a lack of movement variability. You're standing or you're sitting or you're squatting and everything is in one plane, but there's not a lot of emphasis on mobility. There's not a lot of emphasis on recovery, or just moving your body around in different planes of motion. And so that's typically what we see in the busy professionals, as well as, the repetitive strain injuries. A big issue that we see is people aren't spending time doing a proper warm-up, or they're not taking their mobility as seriously as they need to, which, as we know, is more important as we get older. So these are just things that we see generally, but we treat any and all active injuries and individuals.
One thing, though, the reason why I send you people is No, Brendan's not the physio that's like, hey, no, don't go back to the gym. Like, hey, you got to take 3 weeks off and only come see me, and then you'll be okay. And sometimes it's not 3 weeks. Sometimes it's, freaking months.
3 weeks becomes 3 months.
Exactly. So that's a reason why I love sending people to Brendan as well, is because the philosophy matches. It's not like, hey, stop training. It's stop doing what's hurting you in training, work around the injury with everything that you got to do with your physios, your chiros, but then, hey, still work with your coaches to keep going on your fitness goals. So what I would like you maybe to expand on a little bit is like, let us know a little bit of your philosophy, maybe as a chiro, as the owner of the lab, but like, what makes you guys special? What makes you guys different than the typical physio?
I think the biggest thing that sets us apart is, there's several, but the biggest thing for me with working with gyms is our understanding of strength and conditioning. Every single one of our therapists works out, has a history with the sport. So we know firsthand the demands that different activities place in their body. Secondly, we are huge proponents of continuing to exercise. Barring a catastrophic injury that needs surgery or medical intervention, there's no reason why you should go see a health professional for a knee pain and they tell you to completely stop working out. There should be ways to scale. There should be ways to modify. A big thing that I always tell the patients that come to see me is don't let what you can't do stop you from what you can do. You can still train upper body. You can even still train legs with a knee injury. You just have to work around it. And the nice thing with working with TFW in specific is if I have an athlete or an individual that I know is injured and I can send them there, I can communicate with these guys and say, hey, so-and-so is dealing with a tennis elbow. Instead of an overhand pull-up, let's go to a neutral grip for the next 3 to 4 weeks, but continue to progress through strength and conditioning.
And I just want to kind of jump in. Like, I think that's something that needs to happen more. So sometimes in relationships, you have one client, their physio is telling them something else and their coach is telling them something else. And it should be, your coach should be open to what the physio is telling you, not say, fuck that guy, he doesn't know what he's talking about. But on the same side, the physio should also understand you have to work out. So just give you guys different examples. Like, I've had clients who have a broken ankle. They can't jumping jack, they can't run, they can't squat, still come to the program and get amazing results because guess what? They're sitting their ass on the bench. We got them overhead pressing. We got them curling. We got them lying back. We're doing something.
Yeah.
And the recovery process, even though that's a broken ankle, them just moving, blood circulation, doing something, even mentally, it gets them back recovered faster. So like you were saying, like the fact that if you have some sort of injury, it doesn't mean stop doing the things that you're able to do. It's a big, big point.
Yeah. I always like to say coaches and clinicians speak the same language, or they should speak the same language. I should be able to tell him, hey, modify this. And immediately he gets in and we're working together. We shouldn't be two separate entities. When we're dealing with the patient, whether it's a client or a patient, we are two ends of the spectrum. I'm on the clinical end. He's on the strength and conditioning end. And we should be able to cross over and meet in the middle and understand where both of us are coming from.
What would you say is like some main differences that maybe when some people come with you guys, are they like, oh man, like you guys are doing this or you guys are telling me this compared to like your typical physio or chiro?
I think the biggest thing, again, going back to strength and conditioning in specific, is there's too many clinics that just throw Band-Aid solutions. Oh, your knee hurts, put a brace on. Oh, your knee hurts, don't squat. Oh, your back hurts when you run. Okay, try the bike instead. I think what sets us apart is we really try and find the root cause. Is it an old injury? Is it a lack of mobility? Is it training variables? Is it not enough recovery? And then we try and build you up to be able to do whatever it is you have to do or that you love to do. And I think that's something that really sets us apart from other clinics in the area, is just our understanding of a wide variety of activities from professional sport all the way down to weekend gym warriors. We understand it.
You guys got a cool vibe too, though.
We do have a cool vibe. There's always rap music blasting. There's the vibes are high. The staff are friendly.
It's not like your typical, like you go in there and everybody's like all super buttoned up. It's just normal people, man. You come in, you say what's up. There's a good vibe. They have that workout component to it where you see maybe some athletes or more active people. But that's the one thing I like about the place there. It's the culture.
100%.
That speaks a lot. When you just walk into a facility, you feel something. One thing that you said earlier on that I want to hit on is like, if you're someone who trains, the chances of you getting injured, or maybe injured is a strong word, hurt, that's going to happen. And that's one point I want people to understand is if you've been working out long enough, just like if you've been playing sports long enough, you're going to get hurt.
100%.
Right? It happens. What we're trying to control is hurt versus severely injured. And sometimes when I'm doing consultations, and this is people that maybe they haven't worked out for 10 years, 5 years, whatever it is, busy professionals, 40s and 50s, it's like, I don't want to get hurt if I do strength training. And I just want you guys to hear a doctor telling you that, yeah, you know what, sometimes that's going to happen. But what you should be more concerned of is you should be more scared of like diabetes, obesity, cancer, your posture rounding like this because you're at a desk all friggin' day, not moving versus coming to the gym and squatting, doing some deadlifts, doing some push-ups. Like those things are not going to hurt you as much as those other things are going to do it. So maybe if you can touch on like, why do you think people are so scared of, I guess, strength training?
Yeah, I mean, a lot of the times it's just people use older injuries as a crutch, I think, because they are scared to start or scared to commit or they've been hurt in the past. And the one thing that I really want to focus on is, everybody's going to get hurt at some point in time. I deal with this all day, every day. I get hurt sometimes. I go play soccer and I get hurt sometimes. Or strength coaches get hurt. Like everybody gets hurt. What's most important is not recurringly getting hurt. Yeah. Not having the same injury happen every time you bend down to sneeze or to pick up a pencil and having your back go. Like that is the emphasis that I want to focus on is everybody gets hurt. It's very hard to avoid that. But what is avoidable is recurrence. And that starts with finding out what's going on, what the problem is actually, and then building a plan up towards it. Now, in terms of people being scared to strength train, I think it just, for some reason, it gets a bad rep. Sometimes, you see these videos on Instagram of guys doing crazy lifts and, not training properly. But under the guidance of a good coach and a good system, there is absolutely zero reason to worry about strength training. The science is so clear on how much strength training can really impact your life in a positive light. And so I think the one thing that people need to understand is that strength training is probably the greatest thing you can do for your health today.
There you go. And just so everybody got that, a doctor is telling you lift some damn weights because, I know there's a difference between like, what would it be called? The pediatrician or something like that works with kids and stuff like that.
Yeah.
Whatever, your general doctor, a lot of the times, that's what I tell my clients is like, don't go to your doctor. That person's there to help you with the cold or with bronchitis and they're going to prescribe something. Go to like a sports physio where they can help you with the injury or the discomfort that you're going through. Because a lot of times when people go to those doctors, it's like, don't work out, don't lift weights. And it's like, my response is, hey, is your doctor fit and are they actually healthy?
Yeah, 100%, man. You got
90% of the time, they're not.
Yeah.
They're overworked, unhealthy, obese, people giving you advice.
Yeah. And I would say, even as you get older, like the need for strength training only gets higher, right? Like if you're over 35, 40, female or male, your bone density starts to come down. You start to lose muscle mass. Like these are things where you need to be putting some resistance into your hand, on your legs, and become stronger because it's going to help you as you get older to live a quality life.
And they'll probably see you less.
Exactly.
If they're doing it.
100%.
What would you say, like it's always something I always want to get clear on. What's the difference between physio, chiro, osteo? Like you guys have a lot of different services. Like if you can kind of maybe raise a little bit, like what's the difference? How do I know what I need?
Honestly, I get this question all the time. And the way that I answer this the best is the science is the same no matter what profession you're in. We all just chose different career paths based on what we had for previous experiences. Maybe, one of us saw chiro and was like, oh, he was great. Went to chiro school. Some of us in our head were like, I want to be a physio. Some of us wanted to be an osteo. But regardless, the body of evidence on injuries and science and anatomy is the same no matter what textbook you're studying in what school. So the way that I look at it is it's just different billings on insurance is really what it boils down to at the end of the day, right? The way that I treat is very similar to the way that a physio would treat. The way that our physios treat is very similar to the way that I treat. There's so much crossover now. It used to be, you have back pain, go see a chiro. I'm going to tell you firsthand, I see 90% of injuries that are not spine related. I see shoulders, I see hips, I see ankles, I see knees. And most of them are surgical, non-surgical, traumatic, athletic injuries. It doesn't matter. I see them all. There's so much crossover in it these days that I think it just really depends my advice is find somebody that understands the demands of what you're doing. And no matter what their designation is, if they understand the science, that's who you should be working with.
Gotcha. How do you, like, let's say I'm a busy professional, busy parents. I'm now starting to value my health. I'm working out, I'm eating healthier, but I do want to have that relationship with a physio, chiro, whatever it is, just in case when things happen. What are some things that you would say to look out for, like a good place to go to versus a place that's they're maybe just taking your money and not really going to help you get to where you want to be?
Yeah, okay. This is something that I battle with all the time because I hear these stories of people that come from other clinics and I'm like, ah. But my main thing is you want to find someone that's results driven, period, not appointment driven. I want someone that's, going to get me into the schedule, tell me what's wrong, educate me on how to fix it, give me a plan and some exercises, and then tell me to go back to exercising and what to modify. I don't want somebody that's going to say, hey, my week's looking kind of slow next week. I'm going to see you 2 times a week. Or, oh, hey, you're a teacher. You have unlimited benefits. Perfect. We're going to meet 3 times a week for the next year. If you go somewhere and immediately you're told to book sessions, run away. Because that's them inherently telling you, hey, you're not going to get better. I don't expect you to get better for 52 weeks. And there's no plan in place to even decrease the frequency of you being there.
Like, you mean like they're just saying, for 6 months, I'm going to see you 3 times a week?
Exactly, yeah. Mm-hmm. Or, like they see you immediately, okay, we need to meet the 6 weeks, 3 times a week. In no world, even in my post-surgery ACL cases, am I seeing somebody 3 times a week for 6 weeks.
So how do you do it? Is it like a week-to-week or...
It should be. It should be how you present. Next time you come in, hey, Brandon, I'm feeling great. Thanks for what you did. Perfect. Don't see me or see me in 2 weeks. Let's see how it goes.
That's true.
Or if they come in, they're like, hey, Brandon, like, I'm feeling not where I need to be. I think I need to see you more. Perfect. Let's go in sooner. But I think it should really depend on the individual, their goals, and I guess their progress on a week-to-week basis.
Yeah. One thing that I want to add on to what you said is you said the education part. So when you are meeting a physio, I go to Brendan all the time and I'll ask questions. And I know the body, like I know a lot of stuff, and Brendan's way smarter than me in that stuff. Sometimes I know what you're talking about, sometimes I don't know what the hell you're talking about. But the point is I learned something.
Yeah.
If you're going to a physio and they're not explaining anything and you're just sitting there getting stuff put on you, they're not empowering you, right? Knowledge is potential power. I would say that's the same thing with a coach, right? If you have a fitness coach, if you just show up and you're just working out, moving, and you don't understand, I'm doing this exercise because right now I'm focused on strength. I'm doing this superset at 10 to 12 reps because my intention is hypertrophy. Like, they should be explaining to you why you're doing things, because if you know why, it's going to actually improve how you do it and how you do it long term. So I think that's a big point of what to look for is the education. Is there anything else that you want to add to that?
No, if we're just talking about education, I think that's probably like the pillar of our clinic is trying to explain to people why they hurt. Because if you don't know why, you don't know what to avoid. You don't know, you have these people that have chronic back pain and have no idea why, and they're just scared to breathe wrong for the next 30 years of their life. So if you understand why, you can understand what you can do and what you might not be able to do yet.
Yeah.
And I think that's such an important piece.
Dope. All right, so switching gears a little bit, next thing I want to ask, you often refer people to programs, and you want them to keep developing, because a lot of times someone's back pain could be like they're just overweight. Mm-hmm. They don't move, mm-hmm. Like they're not squatting, they're not lunging, they're not doing these things that's going to make them be pain-free. What do you look for in programs to refer? And I guess maybe some tips for people like, hey, these are the type of programs you want to go to if you're going to join.
Definitely the first one is a program that is fundamentally sound in strength and conditioning. That for me is bread and butter. I think no matter what you want to do, whether you're a runner, you should be strength and conditioning. You should be strength training. If you are lifting weights, you should be strength training. If you're just general population and want to be healthy, you should be strength training. So I think strength training for me is finding a facility that understands the principles of strength and conditioning is number one. Finding a place that can regress, finding a place that can progress, finding a place that builds capacity and you don't just come in here and do burpees for an hour and get a sweat and say, wow, that was great. I did burpees for an hour. I burned 1,000 calories and then you're gone. I want someone or a place that builds capacity, builds the engine instead of just burning people out 24/7. There has to be a plan in place. The second is a place that measures, whether that's measuring your weight, measuring perceived intensity on a lift, measuring progress. Like what gets measured gets better. And I think that there's too many places that you just go in, you see a trainer, you see them twice a week because you have that appointment book. You just go, but there's no plan. Yeah. This month we're going to do squats. And then that month is now you're doing squats for 6 months. There's no measurement on it. They don't measure your weight. They're not measuring your program. Things have to be measured, right? Like I said, clinicians and coaches should speak the same language. You wouldn't see a physio twice a week for your entire life with no plan in mind. And the exact same goes for a coach. You shouldn't see a coach with absolutely no plan. If there's a consistent plan, you're in the right place.
Nice. The first point you said was the cardio, basically. So that's a big point. Once upon a time, before I was as educated, a lot of the training that I would do with people was HIIT. Fortunately for me, because my background as a football player, I always had strength training as a core, but I would say I did more HIIT definitely than I do today.
Yeah.
I think a lot of people that are, again, in this category of busy professionals, busy parents, you're in your late 30s, 40s, and 50s, you have to change your mindset from like hot, sweaty, hard, crazy workouts to consistent strength training. Is there a time and place, like he was just saying, improve your capacity to do more, your conditioning, but it needs to be done systematically, not just, okay, guys, 45 seconds, here we go, 3, 2, 1. Okay, here we go, next move. And like people are just sweating and moving. Like that oftentimes is going to lead to a lot of injury.
Yep.
But also, like people don't realize this, your nervous system. Like, man, if you are going from a stressful job, you got a lot of stress with your family, got own stuff going on with your mind, and then you go to a workout that every time you work out, it's nonstop, man, that leads to burnout. That leads to people just not recovering and feeling good about themselves. So that was a big point that I wanted to hit home on. And then also another big one is, like you said, if you don't measure, you can't manage. You can't get better. So for us in our program, what we do like to measure, we measure weight. And a lot of people are like, oh, what do you mean? Weight doesn't matter. Yeah, it does. If you're overweight, you need to know how much you weigh. So we measure your weight. We measure your body fat percentage. And a big part of what we like to measure is we measure your skeletal muscle mass, which is super important. A lot of our clients are women in their 40s and 50s. One of the most important things you can have is good muscle mass on your body, right? So those are kind of aesthetic things that we like to measure, but then also performance things. Hey, for us, a big thing that we like to measure is like, how much push-ups can you do? Chin-ups. How much weight can you lift on a bar, right? But it's like, it doesn't mean you have to be a big power lifter. It's just like, hey, in a safe and intelligent way, how much can you lift in your squat or your deadlift or your bench press? So those are some of the things that we like to measure. And, compare that. Does your coach just have you literally coming to sessions and just doing a random workout of the week? Or are you guys tracking your strength and doing specific evaluations? And are you guys actually tracking, has my weight changed? Has my muscle gone up? And I think another one that's super important is just like mobility.
Sure.
You know what I'm saying? Like, can you, before when you started, you were like this, can you now do this? Can you squat below depth? Like, those are all things that like, the more you age, it's probably even more important. Can you go down and tie your shoelaces and shit like that?
You go down the stairs one at a time. Just simple things like that. It's so important.
Hey guys, hope you guys are enjoying the episode so far. This is part 1 of 2. So make sure you finish watching this episode. You'll see it next week or the next video that comes up on the channel. We look forward to having more amazing podcasts and providing you guys lots of value. Beastie!